My name is Takanobu Tomaru from Toho University, Japan. I am cardiologist and in charge of Department of Clinical Physiology and Cardiology Center. In this morning, I presented a paper about strategies for prevention of cardiovascular event in patients with polyvascular disease. Polyvascular disease and severe carotid sclerosis with other vascular disease has been considered to be at very high risk. And previous papers demonstrated that these patients are very risky. But I feel that prognosis of these patients is not so poor in Japan. Then we studied the profiles and prognosis of these patients in my institute. MR angiography, CT angiography, and carotid ultrasonography were used for diagnosis and follow-up. Carotid sclerosis was classified by plaque score using carotid ultrasonography, and plaque score of more than 10 was considered to be severe, and less than 5 was mild. We studied 102 patients with polyvascular disease, 602 patients with severe carotid sclerosis, and 1,258 patients with mild carotid sclerosis. All of these patients has risk factor of more than 2 risk factors. And we evaluated and followed these patients for 3 years. In 3-year follow-up, the patient with polyvascular disease had 5.8% of cerebral infarction and 1.96% of acute myocardial infarction. And in patients with severe carotid sclerosis, cerebral infarction occurred in 1.9%, and acute myocardial infarction occurred in 0.99%. And in patients with mild carotid sclerosis, the event rate was much lower. So compared with previous studies, our patient prognosis is not so bad, and the event risk is very low. In my institute, we treated the symptomatic cardiovascular or cerebrovascular disease by intervention or by surgery. So these patients were excluded. So in conclusion, in addition to risk reduction, treatment of symptomatic cardiovascular or cerebrovascular disease and early diagnosis of this disease are very important to prevent cardiovascular event in these high-risk patients. Patients.